afternoon, everyone, and welcome to PBA at noon. My name is Paul Benwell, and I'm joined by my colleague, Sophie Caesar. We're pleased to welcome back Pathway Medical President Wayne Cockburn. Pathway Health is one of the largest providers of out-of-hospital pain management services in Canada. They own and operate community-based clinics across 4 provinces, where their team of health professionals work together to help patients using a variety of evidence-based approaches. Their patient care programs utilize an interdisciplinary approach that includes trained pain specialists, physical and occupational therapists, psychologists, nurses, and other healthcare providers. Pathway is a few short days away, perhaps a week away from going public. Their symbol will be PHC, and they will be listed on the Wayne?
On the Venture Exchange.
On the Venture Exchange. Wayne, welcome and thank you for coming today. And go ahead and start whenever you're ready. We'll have some questions for you at the end. Thanks.
Okay,
Wayne.
that's great. Well, thanks, Paul, and thanks, Sophie. This is my second time back, and certainly appreciate the invitation. And I also appreciate everybody coming in today to listen to the story about Pathway. For those of you who are hearing about Pathway for the first time, we're one of the largest providers of out-of-hospital chronic pain services in Canada. We currently have 9 clinics in 4 provinces. However, our goal is to be in every major city center and region in the country. Our revenue has grown from 600,000 in 2018 to about 12.6 million last year, and that's largely due to the acquisitions that we've made since 2019. And we're also the largest medical cannabis telehealth network in Canada. Pathway is also the leading provider, partner rather with Canadian pharmacy companies regarding medical cannabis products and services. And we own some proprietary technology called MySpark. This IT not only connects us with our suppliers and our partners and our patients, but it's also a database of actionable digital intelligence, is how we call it, information that we can actually use to grow the business. We recently closed a private placement for $13.8 million. And our transaction was conditionally approved by the Venture Exchange on Monday. And we've been told that we should start trading sometime next week under the symbol PHC. Our senior leadership team is made up of experienced executives, all with healthcare and operational experience. 3 of our top executives have more than 25 years experience each in M&A, and 2 of us have more than 20 years of capital market experience, including taking companies public in Canada and the United States. Personally, I've been involved in the capital markets for more than 35 years now. So chronic pain is a huge social and economic problem that touches almost all of us, whether it's us personally that's suffering from it or those close to us. It can be caused by injury or trauma, certain medical conditions, wear and tear, or if you're like me, just getting older. It affects 1 in 5 Canadians, and this number is only increasing due to an aging population. It's expensive. The direct and indirect costs associated with chronic pain can be more than cancer, diabetes, and heart disease combined. And there's a real shortage of chronic pain doctors in Canada. And as a result, the wait list to see a specialist can range anywhere from 1 to 3 years, depending on the part of the country you're in. But as Albert Einstein said, in the middle of difficulty lies opportunity. And we see lots of opportunity for the business. For starters, we work in a very fragmented industry, and we have the opportunity to take the lead role in being the consolidator and to continue adding new patients, doctors, and distribution networks for our products. Health Canada is about to come out with more changes to the Cannabis Act, and it's widely expected that most of these changes will be around medical. Now, as part of these changes, it's expected that certain cannabis health products will be made available through retail pharmacy stores right across the country. And this will only enhance our partnering work with the Canadian pharmacy companies, which I'll come to shortly. We also have many partnering opportunities involving workers' compensation boards, unions, insurance companies, First Nations, and more. And in fact, we're in discussions with companies and organizations in each of the categories that you see actually on the slide. We've now reached the scale too, where each new acquisition that we complete will be accretive because we've already built the infrastructure to support them. And finally, and I like to think most importantly, we can dramatically improve access for patients who in many cases are waiting to more than a year, in some cases more than 2 years to see a specialist. Our business is divided into 3 units, clinical services, products, and innovations. In our services business, we have a growing network of pain clinics, currently in 4 provinces. In most of these clinics, we provide a wide range of multidisciplinary pain services, and they're all done by trained pain specialists. And through our M&A work, we've now built the largest medical cannabis telehealth network in the country. And we currently serve more than 50,000 active patients through our telehealth network alone, and this number continues to grow. And this is also the division in which we hold our pharmacy partnerships, which again, I'll talk about in a minute. Our second business unit is our products division. Our initial entry into the product side was through our acquisition of Slaughter Ortho, which is a 70-year-old Quebec business that focuses on home healthcare products. And they also sell other products that support the lifestyles of people living with chronic pain. But we believe the biggest contribution to our product business will come from the sale of cannabis health products through our pharmacy partnerships, and to our own patients. The third business unit is our innovations division, where our proprietary IT, which is called MySpark, is at the center. Now, MySpark is it's an online portal for physicians, for other healthcare workers like nurse practitioners, for pharmacists, for patients, for licensed sellers, and for governments, all to share data. Now, I'd like to talk about how we're going to grow the business. I mentioned that we currently have 9 clinics in 4 provinces. Well, our goal is to have clinics in every major city center and region across the country, not just because we want to be a national provider, but because we need a clinic in each of these centers to support our referral program with the pharmacies. Now, we also plan on converting many of our existing clinics into full interdisciplinary pain clinics where we'll be providing, as I mentioned earlier, a wide range of treatments to all our patients. Now, we plan on achieving our clinic expansion plans primarily through M&A, because in our industry, it simply takes too long to bring in new patients and doctors, and it's very expensive to open greenfield clinics. But we also have a separate M&A initiative underway, and this one is focused on only acquiring patients. With virtual health and telemedicine now such an important part of our business, we can focus on acquiring patients in markets where we already have a presence, rather than adding more clinics. Now, this brings down our cost of acquisition, and it also reduces our overhead because we're not necessarily picking up expenses like new leases, for example. But for the new physical clinics we'll be acquiring, they're all intended to support our pharmacy initiative. So our pharmacy partners have actual paying clinics that they can refer their non-medical cannabis patients to. On the product side, we're working with a number of our LP partners to develop proprietary cannabis health products for our pharmacy partners and for our own patients. Now, these products will include a proprietary technology that we licensed earlier this year that improves the bioavailability of our products. Now, as part of this initiative, we're also moving in the direction of picking up a medical sales license without possession from Health Canada, so that we can sell products directly to our patients, and more importantly, we can sell directly to our pharmacy partners. And finally, one of our primary goals with our pharmacy partners is to help them develop their brand strategy for cannabis health products and to actually co-own the brand with them. This is the holy grail for us. If we're successful with even one pharmacy company, and we're currently working with 2 and there's more on the horizon, that would mean that we would benefit from every cannabis health product sold through that pharmacy chain. And if the Canadian consumer is anything like the American consumer, they'll be buying a lot of CBD products. So our agreements vary with each pharmacy company, but they basically fall into three categories: pharmacist education and certification, becoming the partner for pharmacist referred patients for both chronic pain and medical cannabis, and future OTC product development and distribution in pharmacies. On the education side, we've developed a training and certification program for cannabis for pharmacists, and which they're actually required to have in some provinces rather, just to maintain their license. Now, this isn't a big revenue generator for us, but it's been an effective way for us to build confidence and trust with our pharmacy partners. Now, this trust has made it easier for them to expand our relationship into the other two areas. The first being, excuse me, a referral agreement for their chronic pain and medical cannabis customers. And the second being a development and distribution agreement for OTC cannabis health products. And I'd like to take just a couple of minutes, if I can, to talk about Cannabis 3.0 and how we see it supporting our growth of our business. As I mentioned earlier, sometime in the next 6 to 12 months, the federal government is going to roll out the next round of changes to the Cannabis Act, and that it's widely expected that most of the changes will be around medical. As part of these changes, it's expected that certain cannabis health products, including CBD products, will be made available through retail pharmacy stores right across the country. And here's where the opportunity is for Pathway. Pharmacies are masters at retailing. All you have to do is try to make your way to the back counter without spending everything that's in your wallet, and you'll know what I'm talking about. But with the exception of Shoppers Drug Mart, none of the pharmacy companies have any experience with cannabis or cannabis health products. This is a brand new consumer packaged goods category for them. So at Pathway, we are the subject matter experts, if you will, when it comes to these products. And we're now working with a couple of the pharmacy chains to help them build out this category before Cannabis 3.0 comes online. And I mentioned earlier, and I think this is an important point, if we're successful with even one pharmacy company in co-owning the brand, we would benefit from every cannabis health product, including CBD products, sold through that pharmacy chain. In terms of size, there are more than 40,000 licensed pharmacists working in more than 10,000 pharmacies across Canada. We've already signed agreements with about 1,000 pharmacies, and we fully expect to have signed agreements in place with about 2,000 by the end of this year. Next year, we think we can add at least another 1,000 to that total. Now, to put this into perspective and to show you the potential on our revenue growth, in 2018, the market for CBD gummies in Canada was valued at around 443 million US. And this figure is forecast to increase to approximately 3.1 billion US by 2021 or 2025 rather. And that's just for CBD gummies. We're expecting CBD to be included in everything from shampoos to shoe polish. So you can see why we're spending so much effort on getting these pharmacy agreements in place. On the product distribution side, I've already covered off our co-branding opportunities with the pharmacies, but we also have our own database of more than 350,000 patients who are all potential customers for our products. I mentioned earlier about the proprietary delivery system that we recently licensed. This is a technology that was developed in Switzerland to increase absorption of active ingredients for a number of products that are sold by Big Pharma. Well, the technology also works for cannabinoids, which means we need less active ingredients in our products to essentially achieve the same effect. And it's also important to know that CBD infused products have higher gross margins than pharmaceutical drugs, wine, beer, liquor, and cigarettes. So it's a great business to be in. And finally, through our innovations division, we're developing a proprietary software called MySpark. MySpark is a data-driven platform that connects us to the pharmacies, the physicians' electronic medical record systems, to our LP partners, and to our patients. And because of the volume of business that we do in medical cannabis sales with our patients, we're also linked with Health Canada and Stats Canada to share non-confidential data with the government for their reporting and forecasting. And to our knowledge, there are no other companies that have either this IT infrastructure or the relationships with the end users that we do. And we expect to be talking more about that later this year. On the revenue side, you can see the growth that we've experienced since 2018. We've grown from $500,000 in sales in 2018 to just under 13 million last year. Without any further M&A activity, we continue to forecast strong revenue and EBITDA growth this year and beyond. The margins on our business vary quite a bit, as you can see, but our blended gross margins are expected to remain between 40 and 50%, at least until cannabis health products come online, at which point we'd expect to see that number increase. Now, the growth in our revenue for this year is expected to come from our pharmacy initiative, resulting in higher LP revenues, provincial billings, and product sales. Now, I think everyone is familiar with how strong our industry has been since the early part of COVID. Companies in our sector really gained favor and received a lot of attention, not just because of the relevance of virtual healthcare in the midst of a pandemic, but because of their model of rolling up competitors and also companies on the periphery of their sector, but still complementary with their core business model. This is the same model that we've been using for over 2 years now, one that we're going to be sticking with for at least the foreseeable future. About 6 months ago, we worked closely with one of our investment bankers to put together a peer group of about 14 companies that would allow us to track Pathway's valuation and performance against those companies that are operating in the same sector as us, or in an industry very closely linked to the work that we do. And as I said, the telehealth sector has been very strong, but over the last few months, there's been a pullback to the point where prices now seem to have stabilized. When you compare our going public valuation of approximately $50 million against our peers, the numbers seem to strongly indicate that at 50 cents per share, which was our issue price, the stock is quite undervalued. And I know every CEO says the same thing about their shares. But when you look at the key indicators for the sector, we come in at about half the average of the peer group, even with the highs and the lows taken out of the equation and with the industry correction factored in. Now, this is what our cap table looks like. The top one, Curacan, is a private holding company that owned 100% of Pathway before our RTO. Now, Curacan's shares, along with those of other insiders, represent about 57% of the shares outstanding. And all of these shares are subject to a 3-year escrow agreement. The fully diluted number of shares outstanding is about 113.5 million shares. And none of the derivative securities, including options, are exercisable at less than our issue price, which was 50 cents per share. So in summary, Pathway Health is one of the largest pain management businesses in Canada. And we have a growing database of more than 350,000 patients for services, for product distribution, and for data analytics. Our revenue has grown more than 20 times in less than 3 years. And we're expected to see continued strong growth this year and beyond. We've become the leading partner with Canadian pharmacies for medical cannabis, which we expect will support growth in our clinic business and with our licensed producers and our product sales business. Our IT platform is being developed to include innovative offerings to increase patient referrals for chronic pain and product sales. And finally, we will continue to add bench strength to our already strong leadership team to oversee the future growth of Pathway Health. And with that, I thank you for your attention. Paul, I'm happy to take any questions.
Hi, Wayne. Thank you so much. That was an excellent presentation.
Thanks, Sophie.
Hold on a second. We had here a question. Oh, I guess he's put his hand down. So we'll just go to the written questions. So what is PHC, Pathways plan in British Columbia for revenue generation?
So we're currently looking at a couple of clinics in the Vancouver area. We would like to have, a physical clinic in Vancouver and in Victoria. And again, the reason we want to be in all these major city centers, we can't be in every city, but we need to be in every major city center, is that our pharmacy partners have asked that of us. They're saying, if we're going to refer medical cannabis patients to you, we realize that's virtual, it's online, you could be anywhere in the country. But if we're going to send people to see on the more interventional type of chronic pain, the more traditional chronic pain, we have to have a clinic to send them to. So in BC, we're looking at Vancouver and Victoria.
Okay, excellent. Then we have a question here from John. Is there any issue with CBD supply for the coming wave of new products once pharmacies get involved? If Canada continues to make importing raw materials so onerous and a lack of incentive for foreign producers to sell here?
That's actually a great question. At this point, we don't foresee any problem. We're in a fortunate position in that we're the largest provider. We're the largest customer to all the LPs on the medical side. And so when we call, they pick up the phone. And so we have relationships we've got contracts with over a dozen of the LPs, but we've got a small group, our preferred licensed producers of about 5 or 6, and they're all the largest. And we're not anticipating any product shortages. As far as the ability to import, that's a really good question. And I think Canada sort of lags behind the rest of the world on this. There may be some changes in Cannabis 3.0 on that. I'm not expecting it, but we believe that the current supply of CBD will be certainly more than adequate. And the other thing too is that you're starting to see agricultural communities. A lot of them are now changing over their cash crops from what they've been accustomed to products like hemp,
Okay.
for example, from which you can also derive CBD and CBG. So at this point, we don't see it as being a big problem.
Do you anticipate moving into psychedelics as a product line as regulations begin to change?
That's also a good question. We don't. First of all, we're not involved in rec in any way. We're strictly medical, and we would be very reluctant to get involved in psychedelics unless there was some evidence to back the usage of it. Now, having said that, our largest clinic here in Toronto is about 20,000 square feet. And we're involved at any one time in 2 or 3 clinical studies. We're actively involved in clinical studies. And we're looking at actually getting involved in clinical studies on the psychedelics. People will say, well, how much evidence is there really on medical cannabis? It's a bit of a different story because you've got evidence going back, in some cases, thousands of years. But recently, there's been a lot of very good clinical studies done. We ourselves have been involved in those studies. But psychedelics, I could see that potentially happening within the next 12 to 18 months, depending on the science.
That's soon. Excellent. Okay, so let's go through these questions. Are you pushing the pharmacy education component via colleges or directly to pharmacy managers and owners?
Directly to the pharmacy corporations. So for example, with a group like Sobeys or Lovell, we're dealing with at the upper end. And as I mentioned in Ontario, the Ontario College of Pharmacists have mandated that the pharmacists have to have training certification in cannabis if they want to retain their licenses. Now, not all the other provinces have been that strict, but we could see it going that way because it is a legal drug. Mm-hmm. And with Cannabis 3.0, you're going to be able to buy all these products in the pharmacies. And if the pharmacists can't talk to them intelligently, then something's missing. So we're doing it strictly through the pharmacy corporations.
Okay. And what does that look like? Is that, is there a course module, they log on, they, then, they get their credits and then they can move on and start recommending it? Okay.
Yeah, it's an online training program. There are 4 2-hour sessions, and once they complete it, they receive the certification. And the course that we've created has been certified by the Ontario College of Pharmacists. They've given it full accreditation. So once a pharmacist has finished our program, then they get that certification.
We have a question here. Can you talk more about the delivery technology that you own, and how will Pathway benefit from acquiring this technology?
Well, first of all, we license the technology, and we've parts of the license are exclusive to pharmacies in Canada, which is really what we wanted to protect. I'm not a scientist, and so I can't really describe the mechanism of action, but it is a technology that is incorporated in the manufacturing process that allows much quicker absorption of the active ingredients of the product into the system. So we will be releasing more information on that. We're currently doing some studies on it, but exactly how it works, I can't tell you. But does it work? Yes.
Well, that's what counts. Are there any plans to expand into the US?
Another good question. Obviously, with the US, the opportunities are enormous. We're very familiar with the Canadian landscape. We know the Canadian healthcare system. We know the Canadian industry, the cannabis industry, the pharmacy industry. We still have a lot of work to put our arms around the Canadian market and become that national platform. But having said that, we think that there are opportunities to expand our model into the United States. We're in no rush to do it, although we've been approached by a number of companies to do something. But I think what we want to do is that we want to get it done. We want to get it done right in Canada, and then I think at that point we'll look south of the border.
Great. This is an interesting question. Do you anticipate offering massage therapy as part of pain management in your clinics?
I'm in.
That's actually a great question. And to me, that sounds like somebody that has had some experience with chronic pain. When we talk about chronic pain, we often think about people just getting injections, and that's about it. But people living with chronic pain, in many cases, have been living it with for years and years and years. And it's not just the pain that becomes the problem. There are emotional problems. There are psychological problems. It affects the family. It affects friends. It affects everything around you. And so, yes, the answer is yes. We currently do offer massage therapy. We do chiropractic. We do physical therapy. We're currently in discussions with a couple of companies about bringing in psychiatrists and psychologists, because that really is, when you start to look at that circle of care for those patients, it goes well beyond just the actual therapeutics. It involves massage therapy and everything that I've just described.
Mm-hmm. All right. The MySpark, the telemedicine platform, is your telemedicine platform proprietary like MySpark portal, or are you licensing the current technology?
Well, telemedicine, we currently license the telemedicine. We don't have to have a proprietary system. There's many systems out there. We've been using the OTN system for years. And what's most important is that your telemedicine IT ties in with your electronic medical records. And as I said, there's many of them out there right now. And I realize that a lot of companies are out there developing their own telemedicine platform, but it's almost like Zoom. Here we are. You could develop a comparable Zoom, but Zoom works fine. So no, we see no need to develop our own proprietary telehealth. We're focusing more on the MySpark.
Okay, and so then will you be seeing normal patients and sending their prescriptions to pharmacy partners, or will telemedicine strictly be for chronic pain?
Well, the telemedicine is primarily used for medical cannabis. There's really no need for a patient to actually go in and sit in front of a physician on that. That can all be done through virtual healthcare. But we've also found that virtual healthcare telemedicine can be used with our chronic pain patients that are normally coming in for treatments, because, for example, initial consultations can be done by way of telemedicine. The doctor doesn't always have to have hands-on. They can be used many times for follow-up cases. They can be used for physical therapy sessions if need be. See, with chronic pain patients, for many, it's difficult for them to be mobile, to actually get into a car and go to a clinic. And so telehealth has really, really helped that. Now, having said that, we're all human and we need that interaction as well too. And in many cases, the physician wants to see the patient and the patient wants to see the physician. So COVID has been a very interesting background against which to experiment a little bit with telemedicine. And we think that we found a pretty good balance. In terms of prescriptions, we currently prescribe medical cannabis on the telehealth platform. Those products are actually delivered by the LPs. If we're successful in getting our sales license, we'll have more involvement on that, even though we'll never be touching the products. And as far as all the other prescriptions are concerned, if it's for pain meds or so on, that's all done the way it's normally done. If you or I were to go out and get a prescription, we'd go to the pharmacy to get it, or they would be delivered to our home.
Okay. If you're using the OTN system, how do you see patients in other provinces using that system?
Each one of our provinces uses a different telemedicine system. So for example, and you know, you've got the rules and regulations, and this is one of the reasons why we're not ready to expand into the United States. Each of the provinces has their own system. So for example, if you're living in Calgary, you can't get on the phone with one of our nurse practitioners in Quebec to talk about your issues. You have to talk to somebody in Alberta. And it's only been recently in Alberta that you can actually talk to a nurse practitioner. So we have independent EMR, sorry, not EMR rather, but the telehealth network, the programs, the IT that we use in each one of the different provinces.
Okay. I think that's, oh, no, one just popped back in. I've been on fentanyl and hydrochloride for many years. Unfortunately, it's very difficult on your brain. Does your system hurt less on brain and memory? Yeah.
I'm not first of all, I'm not a physician, but I would certainly invite that the person that's asking that question to give us a call. We'll put them in touch with a physician. It's all covered. The consultation is all covered through OHIP, and they can get those questions answered.
Okay. Paul, I know you have a couple of questions for Wayne.
Yeah, I got a bunch.
These are always the toughest ones.
Yeah. Well, I want to get back to the stock. You mentioned earlier in your presentation that there's a lot of stock in escrow. How
Right.
much is in escrow, and what's your float going to be on day one? Because there's a lot of stock being held back.
Yeah, so there's about just under 60% of the 90 some odd million shares outstanding are going to be held over that 3-year escrow period.
3 years.
So a big chunk of it has already been removed. Excuse me. So the float would be the balance, and about 27 million of those shares were people that came in through the private placement, and their cost base was 50 cents.
Yep.
There's about 2 million shares that are held by the people that are not held through escrow, rather by shareholders of the CPC.
Okay. So I mean, in my opinion, that means that when the stock becomes free trading in a couple of days, that you know, there'll be less resistance in the market for people wanting to get out after the issue.
That's what we're hoping for.
Yeah. All right. Cool.
Yeah. There's no cheap stock out there, and
yeah, exactly. It's one time 50 cents, and that was it.
Yeah.
Okay. Have you been talking to chiros and osteopaths?
Yes.
And
yeah,
what's the reaction you've gotten from them?
In terms of working with us, or in terms of
exactly working with you, and you know, like
well, we work with them. If you exclude medical cannabis and you just look at the more traditional, what's called interventional pain management, we have I think there's 12 physicians in our Toronto clinic, and these docs are mostly anesthesiologists. They're dealing with image guided therapies, injections, implantable devices, pretty high tech stuff. But we also have what are called allied health professionals, and this would include physical therapists, osteopaths, chiropractors, acupuncture, massage therapy, psychologists, psychiatrists, sort of all those other healthcare practitioners that help support the patient suffering from chronic pain.
Gotcha. And you mentioned, you just touched on a minute ago, are all your services covered by the provincial provinces where you are? You know, like the RAMQs or whatever, like here in
Right.
Quebec?
All the consultation services are covered by the provinces. And in some cases, some of the treatments are covered by the provinces. In some cases, they're partially covered. In some cases, they're covered by insurance company, and in other cases, they're private, and there's a bit of a mix.
Okay. Well, Wayne, you know, this is a phenomenal story. I'm so happy that you came back on today. You're going to be listening soon. So everybody, PHC will be the symbol on the Venture Exchange. It'll be up and running shortly. Probably not this week, but like I think most definitely next week.
We're thinking next week.
We will keep you posted and make sure that you're.
Yeah, we'll definitely let everybody know as soon as it goes public.
Well, that's great. And again, appreciate the opportunity. Thanks, Paul. Thanks, Sophie. And thanks everyone who attended today.
I appreciate it.
Always a pleasure, Wayne.
Okay. Have a great day.
You too. Bye-bye.